Partly due to the extremely low number of deceased donor transplants, living donor transplants from family members have become far more widespread in Japan. Japan is one of the leading countries in living donor liver transplantation in terms of technology and the number of transplants. From 1989, when the first liver transplant in Japan was performed, more than 7,000 transplants had been carried out by the end of 2013. In addition, over 1,000 living donor kidney transplants have been performed annually for the past 5 years. Every year, living donor transplants make it possible to save many lives. However, in these procedures, healthy donors need to go through surgery and have their organs extracted, and this poses several problems. First, there is the problem of a risk to the donor's health. In 2003, a living donor died at Kyoto University Hospital soon after a liver transplantation. This was the first occurrence of such a death in Japan. In the follow-up study on the health of liver donors conducted later, about 90% of the donors said they were happy that they had donated their organs. However, about half of them answered that they had some form of post-operative complication, such as skin tightening, numbness, or keloidal scars at the site of the surgical wound. Second, there are issues with donors' consent. According to the ethical guidelines of the Japan Society for Transplantation, only relatives, that is, blood relative within the 6th degree of kinship, spouse, and the relative by marriage within the 3rd degree of kinship, can become donors in principle. The guidelines also state that it should be confirmed at the medical institution that the donor's decision is made freely and not because of coercion or for monetary considerations. However, as in the case of Yusuke, if you are in a situation where a member of your family would die unless you become the donor, it is not easy to ensure that the decision is made freely, and you may feel silent pressure from your family. Third, some people point out the unfairness of living donor transplantation. At present, living donor transplants, including the kidneys, liver, and lungs, are usually covered by insurance in Japan, and this reduces the financial burden imposed by the transplant. However, there may be cases when the family's main financial provider has to become the donor, or when there is nobody in the family who can donate organs for transplantation. If treatment is only possible at the expense of the family's well-being, or only if there is a suitable donor within the family, living donor transplantation can be considered unfair.